March is Colorectal Cancer Awareness Month. It's all about educating Americans about the second leading cause of cancer deaths here in the U.S. And joining us to talk about prevention, detection, and treatment is Dr. Thiru Lakshman, a colorectal surgeon at St. David's North Austin Medical Center. Doctor, thank you so much for being with us today.
Thank you, Guida.
I know a lot of people have questions, but I want you to talk to us about how prevalent colorectal cancer has become here in the U.S.
Yeah, it's quite prevalent, actually. We don't seem to talk about it as much, but really, if you look at the newest statistics and data, it's considered third or fourth most commonly diagnosed cancer in the United States, combined with men and women. And we're seeing these rates increase significantly in younger population of patients.
I was going to say, because we were talking a little earlier about how they've lowered the age to get screened.
That's exactly right. It used to be historically 50 was the starting screening age for colonoscopies. Colonoscopy is the gold standard for screening for colon cancer. But because of the significant increase in incidence among younger patients, these under the age of 50, the U.S. Preventative Task Force actually lowered that age to 45. And I wouldn't be surprised if it gets even more lowered.
Well, do they know why younger and younger people are seeing more instances of colorectal cancer?
Yeah, it's really the million-dollar question, and there's lots of studies ongoing trying to figure it out. We don't really know exactly for sure. There's theories for sure. We think there's probably some environmental factors. We know that in younger patients there tends to be more of a genetic or inherited component to it as well. But most commonly it's really because of sort of lifestyle risk factors, or there's some environmental factors that are now playing into this.
Well, what are some of the symptoms people should look for?
Absolutely. So the most common presenting symptom for colon or colorectal cancer would be changes in your bowel habits, in your bowel movement, specifically blood in the stools. That's probably the first, harbinger that there's something going on. Unfortunately, a lot of times that gets thought to be something else, hemorrhoids or something else, not as serious, but it's important that if it's persistent bleeding or changes in your bowel habits, then that should be checked out by your doctor. And then other sort of more vague symptoms like weight loss, abdominal pain, bloating, things like that. But really changes in your bowel movements is the most common presenting symptom.
Well, talk to us about the survival rates with colorectal cancer. And I guess also you don't really have to go in for a regular screening, do you? There are other ways that you can get screened.
That is true, yeah. So I guess the easiest way to think about it is when caught very early, it's really curable and really preventable. The ideal would be is that you have a screening colonoscopy, you find a small colon polyp, which is really the precursor to a cancer, and that's removed before it even becomes a cancer. But if you get a colonoscopy at the appropriate time and they catch it early, stage 1 or 2, it's really 90 to 95% cure rates. As it progresses from stage 3 to stage 4, that your cure rates and the prognosis drops significantly. And this is one of the problems with colon cancer and why we need screening is so important, because you sometimes don't really present with symptoms until later staging. And to the second part of your question about the screening things, colonoscopy is the gold standard, but there are lots of newer sort of screening tools out there. People, I'm sure, have seen the commercials for Cologuard and things like that. There's even a new blood test that's out. And I think there's value to those tests for sure, particularly just to widen the population to make it easier for people to get screened. But there is not an insignificant number of false positive and false negative rates with those tests. So I still think the colonoscopy is the gold standard. But if unable to get that, then these other tests are available.
All right, lots of good information. Doctor, thank you so much for being with us. We appreciate it.
Thank you.